This is BoomerLife on CL 650.
Hey, welcome back to the show. I'm Zach Spencer, and joining me in studio is our SnoreDentist, Dr. Charnel Muir. Now, SnoreDentist is such a great term, but do people call you that now, or Dr. Muir, the SnoreDentist, when they come into the practice?
I actually get emails, and it'll say, Dear SnoreDentist. And it's usually from the bed partner. Dear SnoreDentist, help! Right?
So you're forever linked to snoring.
I know.
All right. And also joining us is Dr. Mark Murphy, who's based in Michigan, and he's with Prosomnus Sleep Technologies, talking about oral appliances that move your lower jaw forward, opening up the airway, reducing snoring, and helping with sleep apnea. So how do you adjust Dr. Murphy, the lower jaw? So the display... what would you call it? It's appliance that I have here. It seems like the top and the bottom are fixed. So how do you adjust it? Do you have different sizes?
Very straightforward question. I remember asking that same question of one of the developing engineers that worked on the project. And here I was standing in front of him as this, somewhat knowledgeable sleep dentist, and loved the look of the appliance, loved its elegant simplicity, thought it was great, loved some of the design features. And then I thought to myself, I don't see any moving parts. I remember looking at it, and the engineer's name was Sung Kim, and I looked at him, I said, Sung, I said, I don't see any moving parts. How do you adjust it? And he brought his hand around from behind his back, and he had two more arches just like the first ones. And I said, huh? And he said, well, you told us you wanted it to be metal-free. You told us you wanted it to be smooth and easy to clean and all these other features, because they had really listened to voice of customer, really gone out and said to the dentist and to the patients, what would you like to see in an appliance? And then they designed it backwards from there, as engineers would often do, rather than forward, as dentists often do, from I'm just going to hold the jaw full, what's the best way to do it? And he said, so we give you this upper and this lower appliance at the position that you and your dentist have agreed to on the bite. And then when you want to move them forward, you trade out one of the arches, and one of them is just slightly forward, and you can trade that out. The other one is a little bit more forward than that, and you could trade that out. Or you could trade them both out and have it move both of those distances forward. So you could very accurately determine the amount of advancement you wanted to have for the lower jaw, whether it was a half a millimeter at a time or a millimeter or 2 millimeters at a time, whatever it is, the CAD-CAM device would allow you to very accurately capture that. And it was brilliant. And then I was concerned because I said, well, what about the cost? Because now you've got 4 arches instead of 2 arches. It's got to be insanely expensive. And he said, that's the beauty of it. With CAD-CAM, we were able to trade cost of material, cost of manufacturing, cost of human labor in making this thing to be able to solve those other problems you gave us. So you get 4 arches basically for the same price. It's even less expensive than some of the other appliances that are out there. So it didn't become a crazy expensive solution. It became a very, very innovative solution. Really neat.
So, Dr. Muir, I guess getting that sort of baseline where you want the jaw to start is vital, right?
It is. And that bite that we take on every patient is individual to that patient. There's certain guidelines that we require for clearance between the teeth, for instance. I have to allow for enough space for the material that I'm going to put between the patient's teeth. But how far the jaw goes forward will depend on which appliance design we select, what that patient's jaw is like as far as where it starts, and each individual bite registration is specific to that patient.
Well, on a previous show, we had Dr. John Remmers on talking about a new system that you're going to have called Matrix Plus. So in the test phase, you're going to be able to adjust the jaw while the patient is sleeping and get a registration of how well they're doing, stopping snoring and most importantly, breathing better. So tell me how you see these two things coming together.
Right. So it's very exciting for me to be able to offer to my patients the ability to have that dynamic type of sleep study where, we're able to move the lower jaw slightly forward in 0.2 millimeter increments and determine the therapeutic position of that bite for that patient, rather than, as we all do now, where we take a bite registration in the patient's mouth based on averages. The average patient will respond between this and this amount of jaw movement. Now we'll actually have the target set for that particular patient.
So if you had that sort of baseline, and then you add in this device that has stages forward from there,
right,
I could see this lasting a longer period, because maybe after a certain amount of time you go to a little bit more movement and then more movement. Is that am I getting that right?
Right. So my goal is that if I have an appliance such as the Micro 2 and I'm offered the ability of moving that jaw forward, then I can do it in time as the patient progresses, if their condition worsens over time and age, which it often will. So rather than using all of those treatment positions now, I'm able to lengthen that over time. But that's not to say we're limited with those positions. I can then again go back to prosomnus and say, you know what, I would like a fourth position. I've got a 0, a 1, 2, 3. I would like a fourth. And they can produce that within that capacity of CAD-CAM.
So Dr. Murphy, when Dr. Muir has a patient and they need just a little bit more, as you mentioned in a previous segment, you just pull up that patient's information and just make it off of that, right?
Yeah, it's really one of the advantages of living inside a digital world like that is you've really got a permanent record of that patient's upper and lower jaw and the bite relationship that you started with, and any of the iterations of the different appliances you've made at any of the advancement positions forward. This Notice Plus technology, though, is fantastic. John Revers is a physician. If you all had him on, that's a great discussion I'm sure you had. He's incredibly gifted and knowledgeable in this arena, a real pioneer. And the work that they've done with first the Notice and now the Notice Plus, a lot of that work when they were doing the original studies with the Notice was one of the dentists at the University of Calgary up in Alberta. And they did some brilliant work, and they used our appliance because of its accuracy of position and the very things you're talking about. So you having the Notice Plus technology in your practice, you having appliances like the Micro 2, which can be digitally produced and stored. I mean, it's brilliant. It will shorten the patient's treatment time. It will make you so much more successful at treating patients. You won't have that 80, 85, 90% kind of success rate with treating patients with oral appliance therapy. It'll be essentially 100% because you'll test in advance, can this patient breathe better when I hold their jaw a little bit forward? And you'll see that in those sleep studies as it's happening. And you'll say, great, and this is the best position for that mandible. I mean, that's where that technology is so beautiful. Here's a great position to put that lower jaw in so the patient can breathe better, and then you go, bang, let's make an appliance right there. Fantastic. That's awesome.
So, Dr. Muir, when somebody's listening to this radio show, or they're listening now, and they're hearing that you have to have your lower jaw move forward to pull the tongue forward, to open up the airways so you breathe better, you get a better night's sleep. What kinds of numbers are we talking about? Because I'm sure a lot of people think it's going to be your jaw's going to be jacked forward, and that's really not the case, is it?
Right, yeah. So on average, like if we leave the Matrix Plus out of the equation, so what is it that we use to advance the lower jaw forward as far as distance? So most lower jaws, on average, will move forward and back 8 to 10 millimeters. And I'm sure the listeners have heard me talk about this before, but if they haven't, imagine 1 centimeter of space. So they're going to go 8 to 10 millimeters forward and back. What we do on average is we would start a patient anywhere from, say, 30 to 50% of that range of motion. So if they were a 10 millimeter, we might start them forward only 3 millimeters, maybe 5 millimeters. Yeah. Most patients on average are treated anywhere, usually between 30 and 80% of their jaw range of motion. So we're only working within the natural movement of that patient's jaw, and we never exceed that extension for them.
It seems amazing to me that 3 to 5 millimeters makes such a big difference for opening up the airway.
Yeah.
Are the tolerances that tight?
They can be improved by that little amount, absolutely.
Yeah.
So there's any number of things that happen when we move a lower jaw forward. There is moving the actual tissues forward, like the base of the tongue. There's also the prevention of the collapse, which is important, why all the appliances need to have stability in the forward position. We don't want the jaw to be able to slip out and fall back, because then we've got a jaw falling back and something in the patient's mouth. So we want that security and knowing that it's going to stay in place in the position we put it. But then there's also the improvement of the resting tone in the airway. We can actually improve the airway space and tone by using the jaw forward position.
I guess when you're snoring at night and you're irritating the airway. So when you don't snore, that isn't irritated, so it opens up even more? Well,
it does, and it also will improve any of the inflammation. So if an airway has been snoring all night long and those tissues have been rattling together, they're bound to swell up and they're bound to be inflamed. So as we control the snoring and the apneas, the inflammation in the tissue will also start to dissipate or go away, and the tissues will shrink back to their normal sizes. Yeah.
All right. Well, we're going to take a quick break, and we're going to come back and continue our conversation with Dr. Charnel Muir, the SnoreDentist. And the best way to get in touch with Dr. Muir is to go to her website, SnoreDentist.ca. Also joining us on the phone is Dr. Mark Murphy in Michigan. He's with an appliance manufacturer, and we'll continue our conversation next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.